Hi friends, welcome back to my channel, Sharing Simple Knowledge. I hope everybody is doing good. Today I am here with a case note explanation for the beginners. Why I tell it's a letter for the beginners? It's a simple letter, and by explaining in detail, the beginners will get some idea how to write a case note in OET writing. So let's start. First of all, read the case notes below and complete the writing task which follows. In order to get some information, the time allowed for writing is 40 minutes. You will get 5 minutes prior only for reading. During that time, you cannot take any pen or pencil in your hand. You can prepare in your mind at that time. So let's start. The hospital name is given Royal Perth Hospital. So what about the patient details? We have to read clearly the subheadings which are given on the left side. So the name of the patient is Alfred Billy, 52 years old. Marital status is married. Wife to be contacted if there is any sort of emergency. Maria Jennifer, Aralon City Arcade, 207 Murray Street, Perth. That's their address. Then the admission date is 21 March 2010 and discharge date 5 May 2010. Diagnosis is skin cancer, BCC, that means basal cell carcinoma in the neck, nodular basal cell carcinoma. Then the past medical history, no prior hospitalization and no history, that means he was medically free before this disease condition. And the history, the medications, if there is no hospitalization or no history, there was no medication he has taken, isn't it? So what about the social history? He is a truck driver. Then history which supports live with his wife. Her wife is wrong because our patient is Mr. Billy. And live with her wife, it is wrong in the question paper. Then he has the habit of consuming liquor for the past 30 years, cigarette smoker, skin dark, and religion is Protestant. Then medical progress. Skin biopsy is taken for pathological study. CCB, removal of. That is the procedure which is done for the skin biopsy, like that, a curettage and electrode dissection, which is called CCB. Then pain reliever is given Panadine Fort 500 mg. Then the nursing management, no complications noted. What are the management which was given there? Perfectly well at the time of discharge, no complaint of any pain. Then the discharge plan is daily OBS, that means observation, medicine to be taken for 1 more week. So let's read the writing task. What we are expecting from the reader and to who is our reader. So let's read. The writing task is given. You are charge nurse on the hospital ward where Mr. Alfred Billy has recently had his operation. Using the information provided in the case notes, write a referral letter to the community nurse head at Carewell Hospital, Birmingham, who will be attending to Mr. Alfred Billy following his discharge. So what they are mentioning, what all things we have to include in our answer. Expand the relevant case notes into complete sentences. Do not use note form. The body of the letter should be approximately 200 words. Use correct letter format. Don't copy paste the words from the case notes. We can use even synonyms from this one. So whenever we get a letter, First, see what is our position and who is our reader, that we can find from the writing task. See here it's mentioned the community head nurse of Carewell Hospital. Then what is the purpose of writing this letter? It can be found in the writing task and also in the discharge plan. But in this letter only is mentioned medicine to be taken, but in some other letters it is clearly written in the discharge plan. So we have to look at there also. Then why we are referring this one, why we are writing this letter to, so we have to see and mention clearly. So let's see what all information we have to include in this letter. What do you think? Do you want to write the name of the hospital? Yeah, you can include with your position at the last. Then the patient name, of course, we need, and age we need. Marital status, yes, but it's not semi-relevant this one. Then wife to be contacted if there is any sort of emergency, yeah, we can include. No need to write wife's name or address, just we can write live with his wife like that. The admission date is very important. Then discharge date, then the diagnosis is important. The past medical, as there is no prior hospitalization or no history of any medication, no need to include, so no need. Then the truck driver we can include, lives with his wife, we can include that one. Then habit of consuming liquor for the past 30 years, it does not, with this skin cancer it is not related, it's semi-relevant, so even though we did not include this one, it's okay. Then cigarette smoker, and also this is a skin cell carcinoma, not lung cancer. If it was lung cancer we can include, so no need. Then skin is dark, because his skin cancer, maybe the skin that is related to the skin color also it can be, so we can include. Then the religion we can include because it's Protestant. Why we are including this religion, do you know? Because these Protestant people, they may not accept some treatments or blood transfusion like that, they believe it's not good, so that's why we are including this information in the letter. Then the medical progress we can write. Then pain reliever was given, because as we are writing this letter to a community nurse, she should know what all treatment we were given and what all information, and the management should be continued. Then no complications, so no need. Then currently how he is perfectly well at the time of discharge we can include. No complaint of any pain, no need to include. Anyhow we told them he is perfectly all right. Then the what is discharge plan, daily ops and medicine to be taken for 1 more week. So let's see how we can write this letter. I have an example here which I have written. So try to write yourself and compare with this letter. So how we can write? The community nurse head, or you can write community head nurse also, it's right. Carewell Hospital, Birmingham, 5 May 2010. Dear nurse, reference Mr. Alfred Billy, age 52. I am writing to refer Mr. Alfred Billy, who has been diagnosed with basal cell carcinoma of neck. He requires daily observation and management following his discharge today. Because from the plan we got daily observation, then in the case note the writing task. Then the first paragraph begins with Mr. Billy was hospitalized. This is the introduction paragraph. The second paragraph we are starting with Mr. Billy was hospitalized on 21st March 2010 due to skin cancer. Then what was done there? Skin biopsy was taken for pathological study. Then a curettage and electrode dissection was performed. Panadine Forte 500 mg was prescribed, which needs to be continued for 1 more week. No other medications mentioned there, no. So this is the medication which needs to be continued for 1 more week. Currently he is perfectly alright. So we completed what is done. Then next we are moving on to the social history. Mr. Billy is a truck driver who lives with his wife. He is a Protestant. He has dark pigmented skin, or he has dark skin, we can write. If there is any sort of emergency, you can contact his wife. That's done. Then what we have to write? The recommendation. Considering the above information, it would be appreciated if you could visit Mr. Billy and provide necessary care for him. Then the concluding sentence. Please do not hesitate to contact me if you have any queries regarding Mr. Billy. Yours faithfully. Why we are writing faithfully means the name is not mentioned there. If there is name, we should write yours sincerely. Then our position charged as Royal Perth Hospital. It's done. So simple, no? So for the beginners, I think it's very helpful how to write an OET letter. Thank you for watching my channel and also for supporting me. Keep sharing my videos to your friends also who is preparing for OET. Thank you. Bye. Take care.